Well, first I want to say thank you to Chairman Vanderpute. I think she did a great job. I look forward to further leadership now as chair of that committee. We looked at a number of things of how we could try to pull things together more for our veterans. Where I would like to go from here are making sure that the services available to our veterans are streamlined so that our veterans know the services that are available. What's the value in putting so much money into their services if they don't have easy access to that? I also have an interest in sending out a survey to our veterans to ask them what are the important issues for them. We did put more dollars to mental health and the issues that some of our veterans face. What we can't let is just that now go on the back burner. We have more military moving to Texas every day, and we want to make sure that we stay on top of not just the mental health issues and how we can support them, but address medical issues in general. Our VA hospitals are federally regulated and controlled. I would like to actually see if, and obviously I'm just brainstorming at this point, I want to see first and foremost how we can improve the care for our veterans. I would like to see if a pilot study could be done in the state of Texas so that a veteran could use a private or a card that's supported by the government where they can go get health care at the provider of their choice, hospital of their choice, doctor of their choice. I would like to see that piloted. So many dollars are put in to the VA and it's administrative heavy. It's stacked up. Well, those dollars need to follow the veteran. That's where the dollars need to be. And the veterans need a choice. Too many times, I'm taking care of a veteran, it's late at night, they have to be transferred an hour and a half away. But their spouse can't drive that distance and they can't go visit them. I mean, there's a lot in the disparity of their care that I think we can fix. I think that the state, we can go through and start looking, questioning, try to kind of itemize, if you will, the things that we need to improve. Granted, while the power lies at the federal government level, we have a good Texas-U.S. delegation that I will be reaching out to once I evaluate where we are in Texas and we can prioritize some things. I believe that our Texas delegation would like to help and see how they can benefit, their work can benefit our veterans here. I think we all can agree that our military bases are very valuable, provide a strong, or they contribute strongly to our economy. We just have to convince the federal government of that. Having DAG or the grants to partner with the community to help support our military bases, to make them more resistant to closing, if you will, is very important. It's important to the governor, the lieutenant governor, it's important to all of us to try to secure our bases in Texas. So we'll be putting the full weight of the VAMI committee to try to support all of our bases and prevent any closures. We looked at that last session, how we can partner with schools, the Texas Workforce Commission, some reciprocity, if you will, in college hours. We need to make sure that we provide an environment that our veterans can get jobs as easy, that we remove barriers that keep our veterans from getting jobs. So we'll look at that. That's all part of everything we want to do to give our veterans a great foothold in Texas.